Great. Okay, fab. Right, everyone. Thank you so much for coming. We're still expecting a few more, so there might be some latecomers, but I'm really grateful that you're here, and hopefully this will be a really interesting session for us to talk about. I think I said to a few of you in advance of this, we've been working on this, well, we collectively have been working on this for a number of years, and yeah, we're really excited to be finally talking about it. So my name's Joshua Hill. I'm the Chief Research and Operations Officer at Population Matters, and I've got Madeline here, who's my colleague in the room, so she's going to be doing all the important stuff in the background. I think most of you might have interacted with Madeline already. And yeah, I guess we're here as a part of the CPD 58 conference, wider conference. And its effects on child health. And so the discussion, this session will take kind of following structure. I'll do a little preamble kind of context. Then we're going to have 4 kind of presentations. So 2 of them would be Peter and Melinda in the room, so they've been involved in the research. And then, the partners in the field, and time differences are a little bit tricky, and also internet connectivity. So we've got some pre-recorded messages from them, but hopefully they might be able to join us for the Q&A afterwards. And so we're going to have that, and then we'll be at 20 minutes for kind of questions if people have got them, and I'll do flip that up at the end. I think that sounds okay. Next one. Yeah. So Population Matters, who are we? What's it about? So Population Matters, a UK-based NGO, but we work globally. So we've got partners all over the world that we work with. So we work to confront one of the world's most urgent and often overlooked challenges, which is the impact of human population growth on environmental destruction. And our work is evidence-based research and data-driven advocacy. So we tackle the causes and effects of population growth and unsustainable resource consumption. And our ultimate goal is for a more sustainable world for all populations, including humans and nature. And we deliver our mission, as I said, through partnerships, so it's individuals, organizations, policymakers, and we encourage integration of population considerations into their work. So why talk about population? So I love this graph because it just makes it so obvious. So in 1804, the world's population was 1 billion. In 1927, it was 2 billion. So it took 120 years to double, which is, a fair period of time. And over the last 100 years since, it's gone up to just under 8.2 billion. So a huge exponential jump in human population numbers. And if we look going forwards, I expect that to continue to grow. And so the median forecast, and again, you can see the confidence intervals here are pretty big, is that we'll hit about 10.3 billion by 2080. So that'll be the likely peak before dropping down to about 10.2 billion by the turn of the century. And the reason why this is relevant to what we're talking about today is because the health of our children is affected by population growth. And so the majority of the world's children will be born in regions most affected by climate change between now and 2100. So about 3 to 5 billion children, for example, expected to be born in sub-Saharan Africa. And these regions contain the world's poorest countries, which are the least able to, they have the fewest resources to adapt and to shield children from these increasing number of children from the negative impacts of climate change and some of the other issues that we're facing. So this quote is really lovely. So because it really illustrates some of the key messages that population talks about. No one doubts the value of empowering women for education, but when population grows this fast, countries are simply not able to sustain their development. And when education and healthcare systems are overwhelmed or fail altogether, I can assure you that it's women and girls who suffer first and most. So we've seen such a far-reaching impact of population growth on our environmental systems and the natural world and the climate. Clearly, there's been lots of discussion about that. But there's less focus on how that directly affects health outcomes for children. And just to really hammer the point home, this is a lovely quote, well, not a lovely quote, a worrying quote actually from the Department of Economic and Social Affairs, that rapid population growth makes it more difficult for low income and lower middle income countries to afford the increase in public expenditures on a per capita basis that is needed to eradicate poverty, end hunger, and malnutrition, and ensure universal access to healthcare, education, and other essential services. Essentially, all the things that people at this conference care about and want to see improved. So that's my kind of context, kind of ramble. What we're really hoping by the end of this session that everyone's going to take away from this is kind of three key messages. First message that our research has found is that current projections on infant mortality this century are underestimates. So the assumption is they're going to get better, and we believe that that's not correct. We believe they're going to get worse, and primarily that's because they fail to take into account the impact of climate change and population dynamics. What we think the action should be is that we need to have accurate projections, and in order to achieve that, we need to aim, governments and decision makers need to invest more in evidence-based research to better understand the impacts of climate change and population interlinkages. And we're hoping the impact of this will mean that governments and decision makers will be able to deliver more cost-effective solutions, particularly for communities living in these really high-risk regions. So we're going to now have 4 presentations. So we're going to start with Dr. Melinda Judge, who's just here. So Melinda is a postdoctoral researcher at the Kids Research Institute in Australia. She's one of the co-authors of there's many papers that kind of sit underneath this, and she's part of the Future Child Health team at Kids Institute in Australia. And she's predominantly going to talk about the kind of methodological parts of this research.
So firstly, as an Australian, I'd like to acknowledge the Aboriginal and Torres Strait Islander people as the traditional custodians of the unceded land and waters of Australia, and pay my respects to their elders, past and present. In Australia, there's continued disparity in outcomes for First Nations kids compared with other Australian children, and working to close this gap is embedded in all the research that we do at the Research Institute where I work. Inequity in child health outcomes, however, is a global issue, and our research shows that it's worsening, and we're trying to address that. So today, this little overview, I will talk about the current UN child mortality projection and how they're likely underestimates because child mortality, we believe, will increase due to both increasing population density and accelerating climate change. So I'll discuss how children will be impacted differently across the globe, and how this is particularly concerning given that infant mortality is the largest driver of fertility. So more children will be born into places with rapidly growing populations, and that can contribute. Also, those people contribute the least to climate change, but they'll be most impacted by it. So here we have the UN historical data for child mortality rates in the solid lines. So the coloured lines are the different regions, and the black here is the global average. And the dotted lines show the UN projections for future child mortality to the end of the century. And this continuing decline appears reassuring, but we really question if this is accurate because we know progress is slowing, and we know that there are lots of countries that aren't on track to meet the Sustainable Development Goal to reduce child mortality to below that threshold of 25 per 1,000 live births. So we looked at how these projections were determined. And firstly, I want to say, like, as someone who works with data and does modelling, it inherently requires assumptions to be made. So that can be really difficult to figure out what those assumptions are meant to be. And when you're working with incomplete or inaccurate data, such as the case for global child mortality data, it really does make the job difficult. So going forward, so we had a little look at how the projections are currently worked out, and it's really an extrapolate and adjust model. So the previous gains in reductions in child mortality are extrapolated forward into the future, and adjustments are made for HIV/AIDS and crisis events. So there are 9 factors that are considered in the crisis events, and they consist of conflict, extreme weather events, and epidemics. So And they also look at making a 90% confidence interval. So they believe that the true child mortality rate is 90% covered. However, based on our research, we believe that these projections of the previous gains in lowering child mortality are underestimates because they lack adjustment for population growth and climate change. So both of which directly and indirectly impact child health. And of the 9 crisis events that are calculated, we believe that there are about 5 that are directly impacted by population growth, and 7 that are impacted by climate change. But again, these are historical, what's happened in the past, and it's not accounting for increases going forward. And it also doesn't account for larger population, more kids being impacted. So this is a preprint. This is currently under review, and you can access it if you want. Peter will talk about this more in depth shortly, but I just wanted to talk about an aspect that I did of this. So as part of this paper, looking at the impacts of population density on child health, I did a literature search. And from that, I found 40 papers that directly looked at population density and impacts on pregnancy, infant health, child health, and then whole population, but specifically including the child cohort. So what we found that there's large differences in the impacts on population density in low versus high income countries. So first I'll talk about low income countries. And there is a consistent theme in low income countries that when increasing population is associated with improved access to healthcare, there are benefits. So we saw one study of pregnant women where there were improvements due to healthcare access, one on infant mortality, one on childhood stunting, underweight and wasting, and another on improved vaccine coverage and associated outcomes. But independent of the co-benefits of improved healthcare access, increased population density was found to increase the risk of neonatal and perinatal mortality, as well as under 5 mortality. There were also increases in respiratory infections, enteric disease and diarrhea, reductions in cognitive abilities, more sleep disorders, predisposition to diabetes, increased risk of COVID, increased air pollution-related respiratory disease, higher body mass index in some communities, while there were increases in childhood stunting in others, and increased risk of typhoid and more vector-borne disease. So the results for high-income countries there were a lot fewer studies and it was really variable. So high population density was correlated with lower rates of teenage pregnancy, but higher rates of breast milk fungal contamination, both increased and decreased child body mass index, reduced bronchiolitis-related hospitalisation, less binge drinking, and less irritable bowel disease. So it's quite a diverse literature. But while there is variability in child health outcomes, for most of the world's children, in the absence of improved healthcare, the high population growth contributes to the spread of infectious disease and vector-borne diseases, pollution-related illness, adverse nutritional outcomes, and death. So next I'll talk about some of the work that we've done. So on climate change and child health outcomes. So we did a systematic review and meta-analysis led by our colleague Lewis Weeder, and we looked at how measured aspects of climate change impact quantifiable child health outcomes. So Peter will talk about this in more detail, but I just wanted to give a little bit of an overview here. So what we found is that the most studies were done on temperature extremes and air pollution, and definitely heat. Heat was the leading contributor to preterm birth, respiratory disease, and mortality and hospitalizations for children, while cold extremes also impacted preterm birth and respiratory disease. And poor air quality had huge impacts on, obviously, respiratory disease, but also inducing that also impacted premature birth. And we know that preterm birth children have lifelong problems sometimes, particularly respiratory disease, so it's an additive effect. So it's also important to note that these two environmental factors are not included in the UN child mortality projections. So there's no mention of heat and there's no mention of air pollution. So we also saw that too little or too much rainfall impacted gastrointestinal disease and stunting in children. So we need to note that 96% of these studies were done in high income or upper middle income countries. So only 2% were in lower middle income countries and 2% in low income countries. So although that we can see that the climate variables are largely impacting child health, it's likely a huge underrepresentation of what's actually going on globally. So in 2021, UNICEF released the Children's Climate Risk Index, which consists of two pillars. So children are exposed to different environmental shocks and stresses, depending on where they live. So such as heat waves, air pollution, and extreme weather events. And then the other pillar comprises of the child vulnerability score. So underlying child-specific variables, nutrition, education. So the Children's Climate Risk Index is a combination of these. And so for context, the highest risk is for Central African Republic, and they have both the highest Pillar 2 risk, and that's therefore the highest overall risk. Bangladesh has the highest Pillar 1 risk, so those children in Bangladesh are exposed to the most climate shocks, and they have overall quite a high risk index. Iceland is low across the board. The children are at quite low risk. And I've put Australia in here because I'm going to come back to that later. We have a moderate Pillar 1 and a low Pillar 2 score, so overall a relatively low risk. But here we have the distribution globally of the Pillar 1 factors in the orange. So that's how climate is changing and how those people in how those countries are going to be impacted by the effects of climate change. Pillar 2, so the child vulnerability score is in the blue, and the purple is the combination. So you can see that the countries where the most children will be born in the near future are those with the highest risk to climate change. So we then did a study in Australia, because we're Australians and we have access to the data. So we wanted to look at the determinants of mortality in under 5s in Australia. And so we included a lot of determinants of child health. So income, education, housing, access to healthcare, and we also threw in a bunch of climate variables. And after all the analysis, only the climate variables, income and household size were retained in the model. So heat and bushfire smoke exposure were the largest contributing factors to child mortality in Australia. And that's a bit terrifying because every year we keep breaking records, more heat waves, hotter temperatures, and bushfire is rife, if you've seen the news. So, next slide, please. So some of our other work that we've looked at is determinants of fertility. So we looked at fertility in 64 low and middle income countries. And this slide is about to get really busy, but I'll talk it through quite simply. We used nationally aggregated data that was publicly available for a number of sources. And we categorized the variables into 6 themes. So theme 1 was the availability of family planning services. Theme 2 was the quality of those family planning services. Theme 3 was women's education. Theme 4 was religion. Theme 5, infant mortality, and theme 6 was socioeconomic. So we did some complicated statistical methodology. All of our code is available online if anyone is interested. GitHub is up there if you want to get that. But basically, at the end of the day, I'll talk you through our results. So the figure on this one shows the relative contribution of each variable to the variance in fertility, with the grey bars being the raw values and the black bars being the bootstrapped values. So this is the ranking of the variables and how much they contribute to fertility, with infant mortality being the largest predictor of high fertility, followed by household size, which we use as a proxy of population density, and access to contraception. Out of all of the variables that were listed in the previous slide, it's only quality of family planning services as well, more years of maternal education, religion, and access to community health workers that also contribute to national level fertility rates. And on the right, you can see the response curves that show the individual variable, how it's related affects fertility. So figure B shows that higher infant mortality in a country, the higher the infant mortality, the higher the fertility. Likewise for household size, and the opposite is true for access to contraception. And the others also have smaller, but statistically significant contributions. So certainly the largest effect size was observed between fertility and infant mortality. So once infant mortality has exceeded a threshold of 0.0282, so 28.2 infant deaths per 1,000 live births, fertility increases precipitously. So this is highly concerning to us because we believe that the child mortality projections are underestimates and that many countries that already aren't on track to meet the Sustainable Development Goals of reducing child mortality, they're the ones that remain above this threshold. So in conclusion, the current child mortality predictions are extrapolations of historical trends with adjustments for HIV and crisis events. But the projections don't currently adjust for increasing population density and accelerating climate change. And we know that these will have large impacts on child health. Increasing population density directly impacts child health. And while there are benefits associated with increased healthcare accessibility, in the absence of this, the impacts are very detrimental to child health outcomes. We know that temperature extremes and air pollution are the leading climate variables that impact child health, including mortality. And both climate stresses and child vulnerability are unequally distributed globally. So countries with already high child mortality rates will be the most affected. And given that child mortality is the leading contributor to fertility, more children will be born into the most vulnerable regions. Thank you.
Thank you. We have another speaker, Professor Peter Souëf, who is a professor of paediatrics at the University of Western Australia. He's co-author, as you've seen from the paper citations, and leads the Future Child Health Research Team. And he's now going to talk a little bit more about the wider impact of children.
Thanks. Years ago, where we started thinking about it, I'm a paediatrician and I've done global health research and I've traveled to many countries in every continent and collaborated with people on child health. It became readily apparent over the years that I've been traveling that climate was getting worse, that poverty was getting worse in many places where there was crowding, and started to realize that what do we know about child health and what was going to happen in the future. Next. If you look at the global picture and just look at these slides, some of which Melinda's already talked about, infant mortality is high on the top left panel in equatorial regions. In those same regions, climate change impacts are greatest. And in the same regions, population increase is greatest. And in the very same regions, malnutrition is already very common. And Melinda did her PhD in South and East Africa, and the number of children with stunting was over 30% that she looked at. So it's a scenario where high mortality already, things are going to get, climate impacts are there and probably going to get worse. Population is going to increase, but there are not the resources really to look after that issue. When we started this research, we started to realize that really there was very little known about this area. There were very few publications, and we decided that to call our group Future Child Health, because we'd be looking at what was going to happen in the future to child health, and that's been the focus of our work, and particularly for the last 4 years, where we've been looking at what's going to happen to children this century in the face of all of the challenges that are happening with climate change, as well as degradation of the environment, as well as population dynamics changing quite dramatically this century. Next, please. One of the things I want to emphasize is that the climate is really getting worse, and this is data from the northwest tip of Tasmania, which is down here, and that's a place called Cape Grim, which is somewhat prophetically named. It gets the cleanest air in the world. It comes across the Southern Ocean, and it's an admixture of all the air in the world. And it takes only a few weeks for everything to mix up and come across the Southern Ocean. There's no countries out west. And so that we get very good idea of what's happening to CO2 levels. And you can see on the graph that the CO2 levels have been increasing. And if you have a look, it's gradually increasing faster. And what's worse is that since Paris, when there was a Paris Agreement, and since COVID, which was expected to decrease CO2 levels, but in fact, from the data in Cape Grim, didn't show any deviation at all. If it is, it's imperceptible to the eye. But not only that, since then, not only is it increasing, but the rate is increasing. So the rate of use of fossil fuel or our ability, or the planet's ability to absorb CO2 through photosynthesis has been eroding, so that CO2 levels are increasing. Next. So there's currently a mantra that if we use renewables, that will take over, and we can then continue on the path that we're continuing on by having renewable energy, and it will solve our problems. But let me just point to you where the concern is with that. This is renewables on the top left panel. If you look at the blue section at the bottom, that's hydroelectricity, which is finite and has increased a little bit, but you can't keep damming rivers that don't exist. Above that is wind and solar and other renewables, and that has increased quite a lot, but it's only the top little bit of that. So renewables are increasing, that's good, but can it increase enough to replace fossil fuel, and is that happening? If you look at the fossil fuel increase as evidenced by CO2, on the top right panel, you can see, as we've said, that's already increasing. But what, of course, is happening is that renewables are being added to fossil fuel, so that the total energy use in the planet is increasing faster than it ever has in history. Renewables are not replacing fossil fuel. That's very concerning. And that is not what we hear from governments. They say, we're moving a transition using natural gas, and it will reduce coal, and we'll end up using less energy, fossil fuel energy, and we'll end up by 2050 with renewables. Now, where's the evidence for that? Well, we'd like to see it, and I don't think you can say it's never going to happen, but it's deeply concerning that energy use is escalating, because as Bill Rees, who's the father of the global footprint, says, any energy use is in one way or other doing some damage to the environment, and that's an important thing to think about. Next, please. This all supports Jevon's paradox, which I learned was an economic concept. Jevon was a British economist who said that in the 19th century, whenever there are technological improvements that increase efficiency, they lead to increased consumption. So what we're seeing is humans acting out what they've always done. if a commodity becomes cheaper and easier to use, then humans will use more of it. So allowing renewable energy to increase and not stopping fossil fuel with some legislation is heading in the wrong direction. So I say that because I think let there be no doubt that we should have deep concern about what's happening in the future, and particularly for children. Next. If you look at the IPCC representative concentration pathways, therefore, from what I've shown you, you can see that we're actually heading for the worst possible case, which is business as usual. And that is going to increase CO2 levels to around 1200. And data which I won't show you from our institute shows that mammals exposed to those levels in utero, around 900, particularly mice, which is where the studies are done, end up with lungs which are impaired in their function, and cerebral function which is impaired. We don't know that that's going to happen in humans, but it's deeply concerning. And we don't want that to happen to children in the future. If you look at the shared socioeconomic pathways, again, we're heading, at this stage, we're probably heading for SSP 8.5, where the temperatures increase about 5.5 degrees. Even the UN, which is a little bit optimistic about this, has said that the end of the century currently we're heading for 3 to 4 degrees. So somewhere up there is the reality. Next, please. Meanwhile, let's look at the causes of death of children. As a pediatrician, I think I've seen all of these, and these are the WHO data from the world in 2021, the latest that's available. And the arrows point to all of the conditions: neonatal preterm birth, respiratory conditions, congenital birth defects are actually increased as well, malaria and diarrheal diseases. All of those things, there is evidence that with climate change, they're going to get worse. So all of those, as climate changes, more children as a rate will die, which is really worrying. Next, please. This is the work that Melinda's already touched on, and I'm just going to talk about some of the metrics of that, which is a paper which we published last year. The outstanding problems are respiratory disease and also preterm birth. Why respiratory disease? Because we're open to the world. Our lungs are open to pollution and infection, and whereas other parts of the body are shielded from it by not being open to the air. With the area of a human lung is about as large as a tennis court, is often quoted. So it's not surprising that respiratory disease is one of the greatest areas of concern for children. Next. If you look at the odds ratios on the bottom axis of each of these three panels, preterm birth shows the greatest increase for temperature in terms of odds ratios. And that finding is relatively new. So higher temperatures are going to mean more children will be born early. Children born early are more likely to have lung disease and have impairments to their development. And severe preterm children often have other damage. I was a neonatologist for a few years, and I've seen that many times. Also, respiratory disease, the odds ratios are less, but they're still highly significant. And morbidity and mortality for infants and children also increased. The odds ratio is a little lower, but they are increased with increasing temperature. Next, please. Oh, I showed just before. Oh, no, that's all right. In this slide, which is air pollution, which particularly affects both respiratory and perinatal disease, you can see that in the little box at the top for respiratory, the nitrogen oxides, which are increasing, particularly in cities, because a lot of it comes from internal combustion engines, and PM 2.5 both have quite high odds ratios as levels go up. And PM 2.5 also affects preterm delivery, probably because of toxins that are taken in, lung disease, all sorts of things like that, and some of which are indirect. We don't necessarily understand all that information, but there's no doubt that these factors are related. Next, please. Air quality, unfortunately, is going to get worse, and it's going to get worse in the places that are already stressed and least able to cope with looking after children. This is work done by a collaborator of ours, Sam Hefneel, and it was published in Nature in 2015, showing using satellite data that the increase in PM 2.5 had a predictable increase in infant mortality. So an increase of 10 micrograms per cubic meter caused an increase in infant mortality of 9%. And he calculated, and his team calculated at the time, that around 450,000 increased deaths were due to air pollution at that stage. Given that air pollution is getting worse, that's probably increasing now. The panels on the left show the world with air pollution baseline, and the first one, early 21st century. This is increases from baseline, and you can see, again, it's the equatorial regions where are most affected. And as time goes by, that will get worse, because one of the things climate change does is cause stagnation of air in equatorial regions. So those places that are already compromised will have air conditions which are going to get a lot worse on these projections. Next. So I think Melinda has shown that from birth through to adulthood, exposures are going to be harmful to children, that every organ is involved, although there's not good evidence for that based on the analysis that we did. There are evidence from regional places suggesting that every organ will be involved. And unfortunately, temperature will get worse and air pollution will get worse. And at this stage, the reason I stress the Cape Grim data and the renewables is that there is no evidence that we're doing enough to even shift from that. And that's one of the things that we have to do for children is say, if you care about children, we really have to do something. And children have been left out of this equation, and there's very little data about it. Even at the UN, there's not a lot of talk about and not a lot of information about the actual calculations about what's going to happen to children in the future. Next. As we've pointed out, and Melinda's pointed out, most of the children that are going to be born in the next by 2100 will be born in low and middle income countries, and in particular with sub-Saharan Africa, 3.7 to 5.1 billion children will be born there. The mortality rates are already the highest there. The population's increasing fastest, and the capacity to deal with this situation is the most concerning, because 22 of the 26 low-income countries in the world are in sub-Saharan Africa. Next, please. And this shows the expected number of childhood deaths under the age of 1 in a study that we did, showing that the blue dots and the green dots, particularly the blue, are from sub-Saharan Africa, where there is a high poverty index on the lower axis and increasing mortality related. So again, it's deeply concerning for children in the future. Next. And this is where the poverty index is greatest. Again, it's in the same regions. Next. So as Melinda has already said, the projections from the United Nations and also from WHO in collaboration show mortality rates from infants and children that are going down very nicely, because they all use, as Melinda said, retrospective data. They do not take into account what happens after 2022 or 2022 on that side. I think what you've seen is pretty clear that mortality rates and ill health will increase quite a lot in children, unfortunately. We've started an analysis on that in just the recent weeks, and using some metrics. Next slide, please. Based on a paper from the Netherlands, using the socioeconomic pathway 2 and 3, which 2 is quite middle of the road. 3 is getting worse because it's looking at the impacts of other factors than climate change on mortality. What we did was combine that into looking as a metric to find out what's happening by 2043. And you can see that the medium impact produces a really large increase in infant mortality, child mortality as well, of course. And SSP3, which is not the worst case scenario, but we've got the metrics to calculate that, and we will be in the next few weeks looking at what's happened in the future. But I think it's pretty obvious from this that the UN's figures are very optimistic. Why are they like that? Because they've been projected from existing data, and I think probably there's not an incentive to find out how bad things are. I'm not sure why that is, but I think it's the one thing which is not being talked about at the CPD is that things are going to get a lot worse for children. I think why is it important? Well, none of us want to have a world where children die or have high morbidity. Next, please. So climate change and population dynamics will adversely impact child health. I don't think there's any question about that. We absolutely have to have adaptation measures to protect children as climate gets worse. But if we don't do enough as a global population of humans, then eventually the situation will get so bad that the adaptation procedures will be overrun by the climate change and increases like we've seen. So we need accurate mortality predictions, because if we're going to do something, we have to understand the problem. We need to know what's going to happen, and we need to do something immediately, because we'll miss the opportunity. And I think we know that, but this is based entirely on what's going to happen to children. I think there's enough information to say that if we care about the future, we care about children. We need to look after them, and we're not really taking enough interest in developing research, which we need, and certainly mitigation measures, which are global. But in the meantime, we've got to make sure that the UN, WHO, UNICEF continue to get funding. That obviously has been a problem that we know about in the last month or two. I think all other countries need to get together to make sure that we keep the demographic health survey data going so that we know what's going to happen. So we absolutely need adaptation measures for all countries, including wealthy countries, to protect children from what's happening. And UN and WHO, they're the leadership. They're the only group in the world that has global representation, and that they can provide the leadership. And I think that we need to support that. And governments need to do what is needed. They must legislate re-climate and re-energy use. And big businesses have to be regulated by governments. They can't be left to do what they want to do. Thank you very much. Oh, just one last slide, if you wouldn't mind. Just our team. I think in particular, I want to pay respect to Corey Bradshaw, who's done a lot of the modelling and is a co-leader. He leads the modelling. And of course, Melinda, whom you've met, plus Mara West, who's our Indigenous representative, and a lot of new students and other postdocs and workers who have contributed to our work. Thank you.
Thanks, Peter. Lots to take in there, lots of food for thought. So there are two kind of in-room presentations. We're now going to have two additional presentations that have been pre-recorded from some of our partners around the world. Yeah, so unfortunately they couldn't join because either of the time differences or connectivity issues, but I'm going to introduce Dr. Joan Castro, who is a public health specialist with over 20 years of experience working on sustainable and community development initiatives in rural and urban settings. She's the Executive Vice President of the PATH Foundation Philippines, whose mission is to alleviate poverty, improve health, promote environmentally sustainable development. The organisation has been involved in the trailblazing work on population health and environment, so the interaction between those three factors. And so Dr. Joan Castro will now present her remarks on how climate change will impact young people's health and lives in the Philippines, and unpacks the urgent need to continue funding for sexual health and reproductive healthcare.
Greetings from the Philippines. I hope you are all doing well. My name is Dr. Joan Castro, and I'm currently the Executive Vice President of PATH Foundation Philippines Incorporated. Our organization has been working to alleviate poverty, improve health, and promote environmentally sustainable development in underserved communities in the Philippines since 1992. For more than 30 years, the FBI has been a pioneer in implementing integrated solutions across sectors, like HIV/AIDS prevention, family planning and reproductive health, water and sanitation, fisheries, biodiversity conservation, and more. One of our standout initiatives, the Integrated Population and Coastal Resource Management, or IPOC form, has become a global model for combining population health and environmental conservation. Today, I want to take you on a journey. I'll show you how small changes, like improving access to family planning, can ripple out, creating healthier families, resilient communities, and a sustainable future for all. Our work focuses on empowering remote communities, especially women, fishers, and youth. We design initiatives that address sexual and reproductive health and rights, livelihoods, health, and conservation needs in an integrated way. In these coastal communities, people face a multitude of challenges, such as overfishing, food insecurity, poor access to healthcare, and the growing impact of climate change. The communities also experience rising sea levels, stronger storms, high temperatures, and increasingly frequent typhoons, putting their livelihoods and lives at risk. Take Jovita, for example, a fisherwoman I met in the Verde Island Passage, one of the world's richest marine biodiversity areas. At 37, she was pregnant with her 9th child. Her family's livelihood and health were already under threat due to environmental challenges. The warming sea water were harming local fish populations, and increasing sea levels were affecting the ability of the families to grow crops or access clean water. PFPI provided SRHR services, promoted sustainable fishing practices, and empowered women like Jovita with the tools to care for their families and recognize their contributions in coastal and marine conservation. These actions resulted in reduced unplanned pregnancies, healthier children with better nutrition, improved management of their resources, and enhanced community resilience in the face of both climate and economic challenges. While women in these communities face enormous challenges, it's the children and the youth who are often hit the hardest. They're caught in a cycle of malnutrition, limited access to education, and resource scarcity, all made worse by the pressures of climate change. The Philippines has a very youthful population, with over 30% under 15 years old, and nearly 28% are between the ages 10 and 24. This demographic is full of potential, but it also highlights vulnerabilities such as teenage pregnancy rates that are high, poverty, undernutrition, and the increasing impact of extreme heat on the health of the children, such as heat stress and dehydration. At PFPI, we address these challenges through programs that integrate SRHR with sustainable livelihoods and environmental conservation. We have trained young people as peer educators to influence policy change and motivate their peers on health-seeking behaviors and to participate and lead conservation activities. The results have been promising in reducing teenage pregnancies, improved child nutrition, and the communities are better equipped to face future challenges. So by empowering today's youth, we are setting them up to build a sustainable and prosperous future. As climate change accelerates, the future of generations to come is under serious threat. Rising sea levels, extreme weather events, and the spread of diseases like dengue and malnutrition are all worsening. Increasing temperatures are adding another layer of risk. Heat waves are becoming more frequent and more intense, making it harder for communities to stay healthy and productive. These threats are particularly alarming when you consider the growing pressure of population on already fragile environments in the healthcare system. High temperatures, for example, are not only detrimental to human health, but also to ecosystems, affecting biodiversity, agriculture, and marine and water resources. The good news, we can do something about it. What's often overlooked in discussions about climate change is the crucial role of sexual and reproductive health care. When families can plan their futures, when they have access to SRHR services, they are better equipped to adapt to these mounting challenges. So by empowering communities with SRHR, we not only help protect the current generation, but also ensure a healthier and more sustainable future for the next. We are at the crossroads. Cuts to sexual and reproductive healthcare funding, which is what PSDI is currently experiencing, are more than just financial setbacks. They're life and death decisions for countless women and children. Restoring funding isn't just important, it's urgent. It's up to all of us to advocate for policy change, support organizations like PATH Foundation Philippines, and amplify the voices of those who are most affected by this crisis. The future may be fragile, but through collective action, we can better shape it into something better. Thank you for your time, and I look forward to working together to create a future where families can thrive, communities can prosper, and the planet can heal.
I thank Dr. Joan for sending us that. So now we're going to have another pre-recorded contribution presentation, but Dr. Wendo, sorry, not Dr. Wendo, Wendo is also available for Q&A. So let me introduce Wendo Sahar, who is the Executive Director and founder of Dandelion Africa, a grassroots organization based in Kenya that focuses on women's health and economic empowerment. Dandelion Africa has several successful initiatives, including their Voice for Change and Girls for Leaders programs, which encourage young people to embrace gender equity and reproductive health services. Wendo will now present her remarks on why there is an urgent need for us to have more accurate data in order to better support health and lives of young women and mothers in Kenya.
My name is Wendo Sahar, founder and executive director of Dandelion Africa, a grassroots organization based in rural Kenya. I'm proudly sponsored by Population Matters to speak at CPT 58. Now, Dandelion Africa is a female-led grassroots organization that is focused on women's health, economy, and agency. Our work is through integration where we improve health outcomes, economic power, and education outcomes of rural marginalized community. What is interesting about Dandelion is that we are locally led, rooted and deeply embedded in our communities. Our mission is to improve the health and economy of women in rural areas. Now, what are our similarities between you, where you are, could be at the UN headquarters today, and us in the rural arid regions of Kenya? You'll be surprised at how many similarities we have. One of our similarities is that we want to protect the planet. We want to all ensure that people enjoy health, justice, and prosperity. We are all geared towards SDG targets by 2030. Some of the key things that we have in common is that we want to reduce neonatal mortality rates. And I know that different countries have different targets, but currently, we want to reduce it by 12 deaths per 1,000 live births. We want to reduce maternal mortality rates to a target of 70 per 100,000 live births. And most critically, we want to ensure universal access to sexual and reproductive health care services. Now, the global efforts to lower child mortality rates has achieved remarkable success over the past 3 decades. However, these significant improvements are now under threat. The progress made is at risk of stagnation and potential regression due to a combination of escalating challenges. Some of these challenges are fragile health systems, conflicts, crises, economic instability like what's happening in my country, Kenya today, shrinking donor funding, as we have seen globally with the current crisis, and most importantly, climate change, which are altering burdens of disease, shifting the patterns of infectious diseases, making deadly diseases and pandemics more likely, and worst of all, worsening maternal and child outcomes. When we look at the global landscape today, an estimated 4.8 million children die before the age of 5, including 2.3 million newborns. That is just in 2023. Over 280,000 women died during and following pregnancy in 2020 during COVID. 257 million women have unmet need for contraceptive. That's crazy. In today's world, that is just unthinkable. If you look at my country, Kenya, the neonatal mortality rate is at 22 deaths per 1,000 live births. That is so high. Maternal mortality rate is at 355 deaths per 100,000 live births. This can be quantified to 5,000 deaths per year. That is staggering. And only 57% of women have access to contraceptives in my country. Now, Dandelion Africa works in the most remote marginalized areas of Kenya. We want to improve the health and economy of women and children. Today, I'm going to talk very briefly about our backpack nurse model, because it is critical that people in rural communities who have no access to healthcare receive it timely and with dignity. Our backpack nurse model, this is nurses on motorbikes, take services to communities that are either 20, 40 to 60 kilometers away from government facilities. We take contraceptives for free, maternal child health, antenatal, postnatal care, including HIV treatment to those that need it the most. Our programs are integrated to give voice, agency, not just to women, but to youth, because we know that the youth are not just the future, they are here. We have had significant impact between 2019 and 2020, with over 250,000 women accessing contraceptives through our health interventions. We have supported over 36,000 deliveries. And because we want to strengthen health systems, 300 healthcare workers have been trained on postpartum hemorrhage management and newborn resuscitation. Now, one of the most critical aspects of climate change is girls' education. Our role is to improve the agency of girls. And through that, there has been 100% transition rate of our orphan and vulnerable children program, with 67% of them taking up leadership positions. Just by educating girls and bringing in Boys for Change, which is a program that supports boys to be advocates of change, we are seeing a significant improvement in our environment and in our education. Because of all these things, over 100,000 women have started climate smart businesses through saving groups, or what we call VSLAs. Now, despite their minimum contribution to climate crisis, newborns and children bear 88% of the disease burden linked to climate change. Unless these challenges are addressed with clear intention, millions of newborns and young children will continue to die from preventable causes. So, what now? One of the most critical things that we are advocating for is investing in research. From past experiences, there is lack of research into strategies for climate adaptation with a focus on pregnant women and newborns. There is need to further research on women's agency and reproductive rights. This is because it takes agency for a woman to actually seek out an incredible service like reproductive health, so that the data that you are using in these forums can reflect what is actually happening in my village in Risa, in my village in Mogotio. We can address structural inequalities that lead to these increased vulnerabilities. Now, when we invest in research, we provide a platform for the voices of those at risk, for the voices of women in Risa, to contribute to the solutions that best work for them. We are always talking about value for money, especially now with this shrinking donor funding. But there is no value for money without value of data. Data informs. Now, it is approximated that we have over 3.8 million community health workers globally. And this is just from the 98 countries only. Dandelion Africa works with 2,500 community health promoters, of whom 78% are women. We know so much about unpaid care work. But at Dandelion, we train them on electronic communication health information systems, where they visit households, assessing their risk status and access to health facilities, in addition to being the first line of response. This data being collected is shared to our government, and we know that the government shares this data with you. The aim is that they can invest, and you can invest, in cost-effective solutions, for example, family planning, health education, reducing maternal mortality, reducing neonatal mortality. Because without data, you cannot make informed decisions about how to mitigate climate change and how to stop the deaths of women and children. Because whatever happens in my village, in Risa, has a ripple effect to what happens to all of us. It is time for us to think about building, but not building back better. It is time for us to think about building sustainably. Why should you invest in grassroots organization? We identify and focus on systemic forces at the root of our community problems. We are deeply embedded in our communities and we are locally led. This provides local solutions without compromising on the dignity of our communities. For sustainability, we are here. We build permanent structures. We have solutions to our own problems. Now, to strengthen health systems, Dandelion intends to train 200 government health centers on emergency obstetric neonatal care, because we know that even when Dandelion is not here today, that skill will always remain and more women can be saved. We want to train 500 healthcare workers on administering long-acting and short-term contraceptives, because there is nothing more important to women than autonomy over our own bodies. To strengthen our community health, we want to train 3,000 community health promoters on climate mitigation adaptation strategies to support our communities, because they're the first responders. When we do all this, we will be able to reach 20,000 women with skills and knowledge, improving their economy. And you know what they say, when you empower one woman, you empower a full society. So what's our target? We are hoping to reach 1 million women with contraceptives over 3 years. The ripple effect is that 7 million women will be reached around the same time. You can be part of this story by investing in grassroots organization to mitigate climate crisis and ensure that no woman dies while giving life. Thank you for listening to me.
Thank you so much, Wendo. And Wendo, are you there? Are you available for the Q&A?
Yes, I am. I don't know if you can hear me.
Great stuff. Oh, you're a little bit quiet. Is there any way that we can get closer to the speaker? Melinda, myself and Wendo are pretty happy to try and answer them. And we've got some line as well, which Melinda would filter. So we'll sit at the front very conspicuously, which is it was a little uncomfortable. But does anyone have any questions they'd like to ask? And can I please ask you to introduce yourself if you've got questions, which organisation you're from? Speak nice and loudly so that we can try and capture this. Oh, that's a little bit close to come to. Here.
I'm Dr. Yasmin Kazi, and I'm from Pakistan. And another introduction, I'm the board member of Reproductive. This is, of course, thanks for a wonderful presentation, and it was very informative. And of course, what I was looking at the baseline, it was reinforcing the similar messages and talking points that we have been talking for such a long time. It's about the agency, it's about looking at the equity. And when we say, I mean, you have referred, Melinda, in your presentation several times about, which is very obvious, the low-income countries and its impact of the climate change on children's health. But I mean, this is climate, but in general, even within the climate disasters, the equity plays a huge role within a country and a region itself. It's not only country. Because we have seen in Pakistan, of course, which is a very disaster-prone country, the climate changes, the flood that we had in 2010, and the kind of destruction it causes, the most impact is on women and children. And they are the ones who are displaced or impacted and who have done that. And one of the things that, of course, we were looking at children, but one of the things that we have seen really made us horrified is about pushing a very young girls to marriage, early marriage, because they thought it's the solution. And which was, we just panicked, because this was really like, we don't have a house, the climate, and all its impact on social norms and things that we are trying to achieve. And of course, it goes on with the anime, the malnourished, then of course the high chance of MMR and all of that. So, but I just wanted to, I mean, this is all very, this information needs to be packaged in a way that we keep, talking about the baselines that we care for, SRHR, the health system and equity issues, and how can we ensure that women have information and the right tools to manage her fertility. So we have less chances of having those positions in which children are, they're more vulnerable and they're more subjected. And of course, a larger whatever it needs to be done for climate change. So and of course, Pakistan has a very high rate of stunting and malnutrition. That's another huge issue. So I think I'm just thinking about all the things that I can package my topic for within the country, and I think it was very helpful. But maybe sure we can do some of the later work or every time that you please start to present with their own topic when they are advocating.
Yeah, absolutely. Wonderful to do that. But just, I guess the one comment I'll say that is that we can't make choices about information. And so if we're in a situation where people don't have access to the right information, whether that be child mortality forecasts or information about what their choices mean for them, their livelihoods, their children, their families, then fundamentally, that's a bad thing. People, if they're not informed, they can't make right decisions to them. And obviously, people need the ability to make choices, to actually have the right to make the choice. very happy to work with you all, to collaborate, to get this information out there and to make people aware. And it, it's a big task. These are really, really big things. These are things that the international community is working on for a very, very long time. So we're not going to solve this through. But if our small contribution be, let's just get the right data out there so that actually we can talk about things truthfully and honestly, and then we can make the right decisions in the context within. Thank you.
Yeah.
Sorry, do you mind introducing yourself and saying your organization?
Sure. My name is Juliana Boninato, and I work at the United UNFPA, the United Nations Population Fund here in New York.
Yeah.
And I mean, it's really related to what you have been saying. And so currently I work in the Adults and Girls Portfolio, and I also focus on the Global Program to End Child Marriage, which is in part with UNICEF. And a lot of countries that they especially in the Asia region, they have been coming to us and asking more research and data on the impact of climate change on choices of developing girls, but also on how this impacts child marriage. And that's something that's very little research. We're really trying to try to collaborate and do some research on that, but that's something that it's really like a gap area. And something that for me, as UNFPA in general, we see that in research, sometimes it's the whole issue of child mortality is seen like as detached of sexual and reproductive health, where it's something that is so related. And I think that, with this whole scenario of anti-rights movement, I know that sexual and reproductive health tends to be more that there's a lot of pushback on this issue, and that affects everything. That affects funding in terms of projects, but that affects funds for research as well. But it's just impossible for us to, that there's so many issues that are all interlinked. We have to look at teenage pregnancy and how this affects on child mortality, how access to contraception, in conflict settings, you see disruption of all services to adolescents, and you see child marriage increasing and pregnancy rates also increasing. So yeah, I think that I would like to hear maybe your perspective in terms of research and how to maybe to foster more collaboration, looking at research across sexual and reproductive health and climate change, on child mortality.
Yes, so there's two questions. There's one, how does research be more impactful to change and inform?
Yeah.
And I think that's kind of the spirit of what we're talking about today. And the other question is, there's obviously some very, very complicated. Very complicated. It's a very, very complicated area, and clearly we need more funding. And I think there was a joint statement yesterday about 100 countries, CPD, talking about the need, the impact of what $79 billion additional dollars in SRHR and improving people, improving women's rights, access to contraception, the impact that would have on the global economy, and it's a massive numbers. So I think maybe I'll touch on it briefly, and then you guys, if you want to contribute, the impact of research. So I think, as we've said already, if we don't have the information, we can't make the right decision. But research in isolation is meaningless. So there's so much research that's been done, which isn't necessarily done in tandem with policymakers. And so, there's a lot of research that's published that doesn't necessarily have real world implications, and is not used. And so I think the first thing that we need to do is, you just signaled that there's a need for research in a specific area. Population Matters funds research. We specifically, would love to hear of those opportunities. But this is something we'd love to see in this context. This is how we use it. And absolutely, I think more work that needs to be done. I was at an academic conference in Oxford last week. It's exactly, there was hundreds of academics there who know about Prize winners, and this question was debated heavily. So I think it is a shortcoming of academia in its entirety, but also, I think policymakers need to signal us. We have a need for this. This is what we want to see, and that should be linked to also academic funding. I'll just pause there.
I would firstly like to say that
a lot of the work that we talked about was actually funded by Population Matters, partly because traditional funders want to fund disease research. They don't want to fund things in the future, and they find it easier to fund things where they can look at a specific disease. So funding shortfall is a big issue. Funders need to be able to provide opportunities for people to compete for funding to look at what's going to happen in the future. And there's not a lot of work going on, but I'd also like to pay tribute to Professor Souëf who's from Karachi. I'm sure you know well.
He's a good colleague. I worked with him.
We had a long chat with him last week and the week before in Adelaide, where he came to talk. And his work, for example, shows that temperature in the first trimester of pregnancy has a bigger effect on the health of the child than temperature at the end of pregnancy. And his work in Pakistan is exemplary, and he's a wonderful figure and a good friend of ours for many years. The sort of work that Zolfi's doing and the sort of work I think that we're doing there's very little of it. And why is it important? Because unless you have accurate idea about what's likely to happen, all modeling is going to be approximations, but a modeling is better than nothing. But we need to know what the scale of the problem is, because without that information, there's complacency. Complacency means that people won't do enough, they don't pay attention to it, and we need to know what's happening. So we're firm advocates of providing accurate as possible information about what's going to happen in the future.
So I think we're just conscious of time. We'll obviously we're around after the event. People have other questions. But we can take one more question now, and then we'll wrap the event up. That's okay. Who wants to go? I can see four hands. Like it's the gentleman in the corner over there. So please, yes, state the name of your organisation and as loud as you can your question, so we can try and capture the mic.
Right, thank you. I'm Paul Wendo. I come from the Evangelical Church in Tanzania. I have a few questions to kind of address. First of all, thank you. It's just been very informative presentation. I was just wondering, this presentation and out of this finding, did you find any relation or somehow the need to work as a faith community? We understand and we coming from the faith community. There's a lot of correlations with the size of the families, with what the issues to do with sexual reproductive rights. And it's a thing to see. And I was just wondering if that's one of the issues you might do. And then I just wanted to know the cut-off and trading off between some of these issues. You talked about climate, and then you talked about, you also talked about the issues of the household economy income. I was just wondering, trading between a lot of places you talked about, each one takes more toll on infant mortality. Some of the issues. We know the climate change may have different impacts in different parts of the world, and even have some places which may have mortality of climate than some of the places we mentioned. Then I was just wondering, how do we trade off all together? And finally, it's about this whole SRHR, reproductive health, gender justice, and the climate conversation in the world. Do we see ourselves going forward, or we should hope for the best but prepare for the worst? That's part of physical position.
Thank you very much. I think there are three questions there. One is, what's the impact of faith and religious groups? More generally, second one was kind of more methodological, I think, about some of the individual drivers. And then the last question is, it felt like, so what now? How do we use this? Should we just prepare for the worst? Hopefully, also doesn't say. Do you want to do the methodological question? The round. So maybe you can clarify the exact question on. I think you were asking what other factors were driving the mortality. Is that the specific question you wanted?
Yeah.
Because there was a range of factors of driving.
So we did see that so we looked at drivers with fertility and saw that infant mortality was the largest contributing factor, but that is over 64 countries. So we're looking at large scale effects. Everything is regional. So there will be different things happening in all the different areas. So everything's so interrelated. So it's hard to pull things apart. So I guess, and we've got to start somewhere. So we started at kind of regional levels, and then we looked at national and Australian. We're doing lots of research across lots of areas. It's different for every country, every area.
Right. So I think the thing is, when you look at the analysis, there's such heterogeneity across the world. So in so many different districts, you have different factors. So I think it makes it difficult to give an exact answer because of the factors. So maybe part of that question, I'll come back to your initial question. And I wonder if, Wendo, if you're still with us online, if you can hear this well enough, I wonder what your experiences are around, I guess, interaction, religion, and the work that you do. And then I can talk more generally. Okay. However, you might come back to that. But I think what we see in our work generally is that religious groups tend to hold quite a significant sway over social norms. And so social norms are one of the big determinants of why people make the choices they do. Right? So, and I think, with these issues, I think religious and faith-based organizations have a huge impact, a really positive impact that doesn't necessarily compromise, the fundamental principles of whatever religious group you have. And I think that, Morocco is a great example of this. Historically, large population growth, then religious groups helped to shape policy whereby brought into more conscious awareness. We need to be more thoughtful about choices we're making, and think about birth spacing, etc. And so then that had a very profound impact. So I don't necessarily see it as a negative relationship at all, but obviously clearly does have an impact on the SRHR movement, the preferred family size, what people choose to do, how the age they get married, all of these factors. So I think it's a complex interaction, but it's not necessarily, I don't think it's necessarily a negative one. And it's certainly one where, in terms of, if you want to have policy change, if you're fundamentally going to people's identity and beliefs, that can be extraordinarily powerful to help people make different decisions, potentially far more powerful than the central government policy. So I think it's, an area to explore, an area where there probably needs to be more research as well, for us to think better about choices. And then, just conscious of time, I think your final question is a lovely place for us to kind of pause and to reflect. Yes, I think Peter's presentation particularly, it didn't feel particularly rosy, didn't feel particularly positive. But I think what I will just say is that if we have the best information, the right information, and we know how to allocate our very scarce resources in the way that has the most impact, then hopefully we help the most people we can. And while also accepting that the world is a complicated, difficult place, and we can't fix all the problems for everybody, but we can absolutely do our best. And I think that's what we should finish this then. Thank you very much for attending. For those who want to ask questions and talk at the end, absolutely very, very happy to chat. But we took the webinar.
Yeah, Wendo has provided an answer.
Oh, okay. The only way to work religious institutions is through engagement and involvement. So I guess this point I was making as well is religious leaders who preach SRHR in our case because we educate them on the importance of the lack of impact on the community. So it's exactly that point. We need to work jointly in tandem in order to, for us all to achieve our objectives. Thank you so much for everyone online for joining us again. Thank you everyone in the room. Thank you for the questions. Happy to speak afterwards. Thank you.
Thank you.